All right, welcome everybody to Revolutionizing Patient Statements. So, Revolutionizing Patient Statements, and your two hosts, myself, Peter Haas, I'm VP of Business Development here at NexTrust.
And I'm Dan Gasway, the Director of Channel Development. And today what we're going to cover are three themes. The first and foremost, we'll cover the importance of patient statements in the financial experience and the role clear billing practices play in patient satisfaction.
The other important one, which is why probably some of us are on this webinar in the first place, is the challenges that we're facing through traditional patient statements. And then what can BillFlash solutions offer us to help overcome those pain points?
And then we'll talk about the best practices for creating that payment collection workflow.
Okay, so the first part of this is we're going to go over some of the challenges of traditional patient statements. And there's going to be a few. So if you bear with us and we go over these, I'm sure there are going to be 3 or 4 that prick at you a little bit, and you'll feel the pain. Anyway, that's confusion, right? And what does confusion do? Confusion can lead to delays. But imagine being a patient or a payer receiving a statement in the mail and not understanding it properly. Well, that confusion also leads to delay. Can lead to delay of payment or even payment abandonment.
So here are a few statistics. Only 12% of adults had proficient health literacy, according to a study given by the Landmark Department of Education study. They concluded this: 12% of adults had proficient health literacy, 53% had intermediate, 22% basic, and 14% had below basic health literacy. Not very good. 3/4 of Americans ages 22 to 64 report that they know how to use health insurance. That's it. Yet only about 1/5 could calculate the cost of a routine doctor visit. And only 16% of healthcare consumers were able to calculate what they would owe for out-of-network lab tests with a capped allowable charge.
1/5. That's what, 20% down, that only 20% of people could calculate the cost of a routine doctor visit. That seems awfully low.
Yeah. And traditional billing statements, they often contain complex medical terminology. We know they can contain complex coding, billing jargon that they can't understand. It's difficult for patients to understand that lingo. With the existing knowledge gap in health coverage literacy, this lack of clarity can lead to the confusion of the patients, misunderstandings, and more importantly, delayed or incorrect payments, which we've all experienced. And so confusion and complex statements can leave patients feeling frustrated, they feel overwhelmed, and really uncertain about their financial responsibilities.
Lack of personalization, what does that mean? I'm sure all of us on this call have received a birthday card that somebody bought at the store, but they didn't actually fill any of it out. And so we got the generic one-line statement inside. Generic billing statements fail to address the specific needs and preferences of individual patients, just like that birthday card. And so without personalization, patients may feel disconnected from the billing process, which, what does that result in? We just saw decreased engagement and delayed payments. So a lack of personalization makes patients feel just like another number, a cog in the system, which leads to a sense of disconnect from their healthcare provider, which is opposite of what we're trying to accomplish.
So let's talk about some of these limited payment options that our customers often have. Traditional billing statements often offer limited payment methods, such as checks or phone payments only, right? Which may not align with the convenience and preferences of our current patients today, modern patients. So this also leads to delays in payment processing and decreased payment satisfaction as well.
Traditional paper statements. I mean, we're going to talk about paper statements today, but let's talk about some of the issues of what goes on traditionally. Delays due to the billing cycle of your practice, or the risk of being sent to an incorrect address if current patient information is not kept up to date in our system. And that right there is a huge headache and load at times. And then what else is there? Patients may not receive their statements promptly, causing further delays. You guessed it, in payment submission and affecting the revenue cycle.
And then also traditional statements, they may not provide clear instructions or a clear call to actions for patients regarding their payment obligations, their due dates, or any available financial assistance programs they have access to. So lack of clear call to action makes it challenging to communicate payment expectations and resolve outstanding balances promptly. And this, of course, can result in, again, confusion and missed payment opportunities for all of us.
Limited communication channels. So traditional statements may not provide multiple communication channels, as you see on the screen. I don't want to read it for you, but oftentimes our patients, our payers, need to seek clarification, ask questions, resolve billing concerns. So limited communication channels and unclear instructions hinder their ability to seek those clarifications or address concerns, leading to frustration and decreased patient satisfaction.
And without that tracking mechanisms, those robust tracking mechanisms, I should say, the healthcare providers, they may struggle to monitor the status of patient payments and reconcile accounts effectively. And potentially that leads to financial discrepancies and revenue losses. Inaccurate data can also prevent you from making informed, data-driven decisions that would optimize your revenue cycle as well.
Inefficient collections workflows. They hinder our ability to follow up on outstanding balances and effectively engage in collection efforts. Without a streamlined collections process, we as providers, as practices, may experience difficulties recovering unpaid balances, which of course impacts our overall revenue.
So right now we're going to address these common issues and pain points through our enhanced patient statement solution, the solutions that we do have, such as those offered by no other than BillFlash. They can have a positive impact on all facets of your practice management. So right now I'm going to turn the time over to Peter Haas, and he'll go over the next few slides and talk about some of the solutions that we have at BillFlash.
Obviously, we'll start with mailed statements and what sets us apart. The print and mail is still a huge part of what we do in reaching out to our patients. And so if we back it up a little bit, if anybody on the call is still doing this as a manual process, just touch on that real quick. So if we look at what it costs us to do that in-house, so stamps are up to 60 cents a piece now. There's other supplies involved. There's the envelopes, and then there's the labor. Let's pretend we were paying somebody as low as $10 an hour, which good luck finding somebody that will work for $10 an hour. But we're trying to have conservative assumptions here. So we'll go off that $10 an hour. If you figure that out, on average, a practice is spending about $2.59 per mailed statement. That's regardless of whether you're sending out 100 or 1,000. And so right there, boom, BillFlash saves 65%. So that's right out of the gate if we're doing it manually. But let's look at some of the leverages or advantages we have using print and mail through BillFlash. So print and mail statements, as you see there, are still the most reliable way to send a legal notice of financial responsibility. That does not mean that we're not going to give notice to our patients in other ways, but print and mail is still the best given the high USPS delivery success rates. Customizable templates, what does that do? That allows practices to easily add or edit messages, specify the form of payment you want, or change the color of the statement. You can easily review and edit and approve the statements. It's all done in a very simple dashboard. During your review, you can edit, delete, add or edit messages. Very simple. Fast delivery. How fast? Well, approved bills are mailed first class USPS the very next business day. That's how fast. Automatic address updating. So this is something that we just touched on a minute ago, is making sure that our information in our system, in our practice management or EMR systems are up to date. Well, with the USPS National Change of Address Service, the NCOA, bills are automatically mailed to the new address, and you get a report of changed addresses to update in your system. So there's no more return bills that you have to pay to resend. Coupons and envelopes, helpful payment coupons and return envelopes are included, which when used reduce your processing costs and troubles. There's online payments. So mailed bills also enable and encourage payers to view and pay their bills online or by mobile for your mutual benefits. There's another one that's not on here I want to touch on. Viewing mailed bills. Your staff can view the same bill that payers receive so that you can easily understand and answer any questions if they reach out to you. And then that last bullet point, billing reports. You can easily find bill processing details and change of address reports to update your records. So with BillFlash mailed statements, you have the flexibility to create customized templates based off of location or provider. And so we refer to those as sub-accounts. And so if multiple sub-accounts exist, then you have the flexibility to adjust all of those things, ensuring the right messaging reaches the right patient every time. So statements can be reviewed before sending and approved with just the click of a button. And obviously, we believe that a payer statement file should always be reviewed before approved. While reviewing the file, you'll be able to do a few different things. You can preview the payer statement. You can customize the template. You can exclude a payer from being sent a statement. Let's say it was your mother-in-law and you weren't going to bill her. You have that functionality right in there to take her out. You can't take her out of the family, but you can take her out of the mail sequence. You can change the delivery method. So if you're also enrolled in e-bill notices, which includes emails and texts, right there you can choose the delivery method that's most efficient for you and the practice. In fact, I should jump ahead here. You can add custom messaging. And as we've mentioned, you can change the color of the statement. And I'll touch on that one a little bit more. But as stated, approved mail statements are sent first class the very next business day. Any approval or rejection may be canceled on the same day until 6 p.m. Eastern. So using color to drive results is an interesting one. One of the tools at your disposal is the ability to change the color of the statement, choosing from black, blue, green, or red. So you'll see in this example that we're using a red printed statement to emphasize the urgency of the past due balance, and added a custom message to inform the payer that they may contact us to arrange a payment or they will be sent to collections. You can see that right under the dotted line under the coupon. And as mentioned, there are some other colors. Our most popular color is blue right now, which just adds a little professionalism and modernization to the statement going out for a little bit more of that connection. The automatic address update. So we include the National Change of Address service with every approved mailed bill. So if you send a patient statement that has outdated address information, rather than receiving the statement back as undeliverable, we'll automatically update the address and forward it to the patient. And then we'll also include the updated address information in the NCOA report that we have within your BillFlash account, so you can update your PM software with the new address. And then what's the purpose of why do we send a bill? There's usually only one response to that. We send a statement, we send a bill because we're looking to get paid. And so what can we do to get paid faster? Well, according to a survey conducted by Consumer Action, 74% of the respondents preferred to receive their medical bills still by mail. 3 out of every 4 people said, I still want to see it in physical mail form. But the majority, over half, said they would prefer to pay their bills online. And we actually have another study that says as high as 85 to 90% of people would prefer to pay electronically. So it's a large portion of our patient base, regardless of demographic, by the way. That is not an age thing. So we need to give our patients what they want, which is the reliability of a mailed statement, coupled with the convenience of online payments. So QR codes unlock this capability and make your mailed statement have even more value. And what does that do? It drives faster payments. So we have added free QR codes. This is brand new, just launching, but we've added these to our mailed patient statements, making it easier than ever for your patients to view and pay their bills online at our payment portal that you're familiar with, myproviderlink.com. In fact, I'm going to let Dan talk a little bit about NPO.
Thanks, Peter. So as Peter mentioned, we want to make getting paid a lot more convenient. So BillFlash mailed statements contain a link, as Peter mentioned, to the myproviderlink.com and our online payment, which is obviously our online payment portal. This is where patients can view their statement online. And if e-bill notices and pay services are added to your BillFlash account, the mailed statements will also include that QR code that can be scanned for even faster online payments. Let's talk about these billing reports. So after mailed statements have been processed and mailed, the report data will update with mailed date. The USPS also provides 2 additional reports, the address change report and the not mailed report. So the first report is the address change. It actually provides the new payer addresses for those payers who recently moved and left a forwarded address with the USPS. The second report is the not mailed report, and that provides a list of payers whose address could not be verified, and because of that, their statement was not sent to them. And these reports require you to either update the information in your office management software or to contact the actual payer. So in continuation of these billing reports, when you view that billing reporting section, be sure to review the number in the total docs column as you see in that hyperlink. So when you click that hyperlink, it opens the delivery detail report. And this report provides detailed information on the method of delivery. So it specifies if an e-bill notice was sent via email or it was sent via text. It also gives access to view every statement in the file and lets you see any payments made via BillFlash by the payers in that file. So remember, and this is a good reminder, you're actually only charged for the statements that you approve. We have to remind people time and time again. Once a file has been approved, you have until 6 p.m. Eastern time to cancel that approval. And this allows for obviously last minute changes. If, for example, a customer makes a payment after the statement file has been approved, you'll be able to cancel that approval. And this also allows you access to edit the file and remove the statement for the since paid account balance. So once you're finished making your changes, you'll need to approve that file again. And here is a tip, of course you could see below. It's recommended to send those statements as soon as possible and keep your invoicing on that regular schedule. And the recommended billing cycle is 28 to 30 days. And please keep in mind that the longer you wait to send statements, the lower the chances are, of course, that you're being successful in collecting those payments. We just have a couple slides left. When you do run into instances where escalated collection efforts are necessary, it's simple using BillFlash's integrated collection services. It's really as easy as sending these statements that we were just talking about. What we will do is we'll assist you in settling the collection parameters in your BillFlash account, which will automatically flag those accounts that match the criteria for your review. And after these parameters are established, reviewing those flagged accounts that are recommended for collections will be part of your normal processes of uploading and reviewing those statements. And you'll be able to review accounts that are qualified for collections, which will be displayed with balances in the collections section. And you can omit any of those which you don't want to send to collections when approving your statement file.
Thanks, Dan. That was very comprehensive. Appreciate that. We're not going to toot our own horn. We'll let Rochelle do it here. Obviously, she's one of many satisfied customers, but the purpose is the user-friendly part, becoming more efficient. Hopefully some of the things that we talked about today, not just the pain points. We all experience pain points, especially as we're trying to run a practice and keep everything flowing. But hopefully some of the solutions and the bits and pieces made sense to where, can we adjust one of our workflows or one of our current practices to make things easier. With BillFlash mailed statements, providing your patients with legal notice of financial obligation in a way that drives faster payments is simple and convenient. And that's the purpose. Going back to the comment I made earlier, why do we send out bills in the first place? Why do we send out a statement? It's because we want to get paid. And the faster we get paid, the better. And the more simple and convenient we make it for our patients to pay, the faster we'll get paid. BillFlash mailed statements is just one of the many services in the comprehensive suite of BillFlash solutions focused on getting you paid. We talk about all these others at other times. Obviously, today was focused on mail. But if you have any additional questions about any of the other services we offer, or even about mail that we didn't cover today, you can please reach out to us at BillFlash.com and schedule a time to sit down and chat. So thank you so much for joining us today. Have a fantastic day. And remember that at BillFlash.com, you can schedule a demo. You can reach out to Dan or I. If there's something particular you need, it's just our first and last names at NexTrust.com, our emails. And other than that, remember that it's a great day to have a great day. Thank you so much.